Hello, I'm Mark VanLandingham. I'm a professor in the Department of Global Health Systems and Development in the School of Public Health at Tulane. I've taught a lot of different courses since I've been here. I've been at Tulane. This is my 14th year now. When I first came in, the courses that they asked me to teach was first the behavioral science course, the core course, which I taught for about a decade. The other course that they asked me to teach was a qualitative methods research course. I do both quantitative and qualitative research methods, and so I was teaching the qualitative methods course for a while. I've taught overseas courses both in Thailand and in Vietnam, a general research methods course for our Vietnamese students. We had a big cohort of Vietnamese students who were coming in for a number of years. And the course that I'm currently teaching now is called Population Studies, which is an introduction to demography. I'm a demographer. It's really the main focus of my research. For my career, I wanted to do something either important or interesting, and I think I would have been happy, with either one. And a lot of careers, give you a lot of interesting things to think about, but may be somewhat esoteric. Academia, for example, very interesting stuff, maybe not that big of an influence, at least in the short term. A lot of other careers, you can feel like you're doing something really important, but not necessarily all that academically engaged. So for me, I really feel that I got the best of both worlds in public health. It's really important, the things that especially our students do when they come out of the program, to try to improve the lives of people or societies or communities more generally. So very, very important. And a lot of it's also very, very interesting, especially in our department where faculty are focused on these interacting influences. Some of them are in the physical environment, some of them are in the social environment, some of them are in the healthcare systems that are delivering services, norms, culture. All these things are interacting in very complex ways to have a big influence on health outcomes for large groups of people, and also to have an influence on the types of decisions that people make that also have an influence on their health status. The country that I've been most interested for my career is Thailand, and what I have going on there now is actually teach some courses there as well. My research project is to look at people who are leaving the rural areas and moving to the big city, just like they are all through the developing world, and looking at the health implications of that. Domestically, I'm very interested in the Vietnamese population here in New Orleans. That's part of what brought me to Tulane in the first place. So I have a really long-term study, longitudinal data, looking at their health and well-being compared to people in Vietnam who didn't come. And the thing that I've been really interested in lately is why are they doing so well compared to similarly affected groups after Katrina? They've come back in larger numbers, their health status is better. I don't really understand why. I'm not sure anybody does, but I'm working on a book. I just got a book contract where I'm going to be exploring this for the next year or so, trying to figure out what the answer to that question is. What do I know now as a professor that I wish I'd known then? And I also did an MPH in a program very similar to this one at the University of Michigan. Great program, worked out really well for me. I was just lucky. You may not be so lucky, so you need to do your homework. What I wish I had done is research several schools. I wish I'd visited. I wish that I'd talked to other students about not only the quality of the faculty, because the faculty are the school. You need to make your decision based on who the faculty are. How good are they? And then how accessible are they? Because you can go to a really great school with your absolute superstar faculty and never be able to have any contact with them. And then you could go to a school that's not that's less great, where the faculty aren't as prestigious as what you want. I think there's a lot to be said for a program like Tulane that's in this Goldilocks, not too hot, not too cold spot, where you have a lot of really high quality faculty who are also accessible to the student.